Hi, I'm 6 months post-top surgery. I had double incision with Mr. Kneeshaw in Hull at the end of October last year, and I've been taking a few videos and a lot of photos, keeping track of how it's been looking, how it's been healing, and also a couple of little problems that I had along the way, but let me start now by saying I am very, very happy with the results that I have gotten. The first video I made about top surgery was documenting just before having it and all the way up until I believe it was 10 days after having it. So this will be everything from that point all the way up until 6 months today. I had a couple issues towards the start and even along 3 and 4 months with small seromas and things like that, which were basically little pockets of fluid that would slightly open up the scar and it would keep closing and opening and closing and opening, and it wasn't anything huge to where I was extremely concerned, but it definitely did keep putting me down and it would ruin my mood often whenever it would happen, because it's just like I want it to heal already and it keeps on opening up and seeping and it wasn't fun. And it also makes you worry about how my results are going to look as well. My left scar is quite a bit more stretched than my right scar. They're not exactly 100% symmetrical, but now that they're starting to fade and they're starting to flatten as well and they're not quite as angry, I'm definitely a lot more at peace with that than I was earlier on, which also links to the depression that I was dealing with earlier on in top surgery recovery as well. Post-op depression is definitely a thing. I definitely had it really, really bad, especially in the first 2 months post-op. It was some of the worst depression I've ever experienced, and I've gone through some bad depression. It didn't mean that I wasn't grateful for the surgery that I've had, and it didn't mean that I didn't even like the results at the time, because I did. It's just when you feel so lonely and helpless and you're not able to do any of the things you usually do, also coupled with the extra factor of now I can't even go outside if I want to because pandemic, which when it was going on in October in the UK, yeah, lockdown was really, really strict because that was our worst peak for COVID, and I was very lucky to even have been able to have surgery at that time, because right after it the whole country locked down, so I got very lucky there. But the depression that I dealt with was very, very difficult. That being said, I'm feeling a lot better now. I'm now 2 months post-op with Dr. Kneeshaw in Hull. Well, I'm about a week over 2 months post-op, but same thing. I've hopped out of the shower so I can show the process of changing the micropore tape that I have to wear for, well, 3 months, until 3 months post-op. So it'll only be a month from now where I don't have to do that anymore, and I can start using the bio oil and the E45 cream that I have bought in order to use when I'm allowed to make my scars nice and soft and hopefully fade a bit better. It's been a really eventful 2 months, and also like a very uneventful 2 months. It's mainly just been like an emotional roller coaster for me, but this whole time I've been inside doing absolutely nothing. And there's a lot of beeping going on outside because of some trucks, but we're just gonna ignore that. So if I get close to the camera and I show you what we're working with here, got this scarring, and well, I mean, here is our right side. You can still see like markings from where the drains were as well, but those will fade over time, just like the scars themselves. And this side as well. So this side here is having a little bit of trouble closing up. So what had happened was, I had a bit of a seroma, just a small one, which basically meant that it like was kind of refusing to close a little bit, and it kind of opened up on the wound, and it's still now a little bit open. So what I had to do was I had to go and buy these inodine dressings, is what they're called. Inodine, they're like iodine dressings to minimize the risk of infection and create a less bacterial environment and all of that. I wore those, well, he told me to do them for 10 days. I did it for 10 days and the wound had still not closed up, so he told me to just keep on doing it until the wound closed up. But I also read online you're not really supposed to wear them for any longer than 10 days, so I kept going for about 2 weeks, and after that I was like, right, no more, because it also meant having to tape masses and masses of micropore tape to my body to keep it affixed because they are non-stick dressings. It was a whole thing. It was stressful for me emotionally. It is looking a bit better than it did before, but at the same time just annoying that the left scar, at least to me, is a bit more noticeably wider than the right. But either way, both of them will probably fade in the same way, so it's not that big a deal. But that's one of the things that's been happening. I'm gonna go ahead and put the micropore tape on now because I don't want to leave it all exposed for too long. I think the main point of it anyway is to, it's like having constant pressure on it, like the effect of a binder, but obviously less compression because you don't need that at this point at like 2 months post-op. But I think from the research I was doing, the micropore just helps to have some kind of constant effective compression to keep everything together, which I mean as tape would, because it's sticky and all of that. So I'm just going to pop her here and smooth her down, and hopefully in enough time using micropore like this should help that wound heal a bit as well. And then I take some scissors and I just I try to straighten my back while I'm doing it, because sometimes then it feels tight if I stand up too straight. I'm like, oh, I might have pushed the tape down a bit hard. Tape going all the way down there, tape going all the way down there. And that's how I dress it. And also, while I'm here, let's talk about nips. So pretty much all of the pigment has returned to this one. It like scabs over, goes completely white over time as all of the scabs fall off, and then the color comes back. One of the things that I know and that I knew going into is sometimes, especially if you're a person of color, it tends to be a bit more common. Not all of it comes back. That could be due to a scab falling off a bit too early or whatever. In theory, this still could have a chance to come back and be completely brown. In theory, it could. Maybe even a year from now. If it doesn't, it's not the end of the world, because you can just get a tattoo to restore the color. It still feels the same. Their nipples, what can I say? They're doing their job for the most part. Another one of the issues that I had towards the beginning was that the post-op binder that they sent me home with, they send you home with like a little zippy up compression vest. Well, I don't think it's the same for everybody. That's the one they sent me up with because it is, I guess, the smallest one they had. And I was like, wow, this is so loose. And you saw it in the last video. It was, you know, the white one. Wow, it's so comfy. It's so nice. And I was starting to get kind of suspicious, like, this is too nice. Surely this is supposed to have some amount of compression. And the answer was yes, it was supposed to be a compression vest, and it wasn't giving me any compression at all. So I emailed the doctor and he was like, okay, we'll send you another one. Like, okay, cool, because that one was supposed to have compression. And they sent me another one, and it was so small. I mean, for comedic effect, I would get it out and try to put it on, but thankfully I already recorded that video. I mean, safe to say, it didn't fit. It was a bit of a tight fit. To say it was a tight fit would imply there was any kind of fit going on. It didn't fit. So, okay, new plan. They send me another one of the exact same one because they can like strap onto each other to create like a human centipede of a binder. And I had to strap those two together and use that as a binder. In the meantime, while waiting for that all to come, because that took about 2 weeks in itself, I had to wear the post-op binder that I was wearing in the hospital, which was really uncomfortable and horrible and traumatic. So that also put me in a really, really bad mood all of the time. It was really, really rough, to say the least. So I now have 4 hospital binders sitting in my room. Mind you, surgery itself is great. I wouldn't be able to wear a white t-shirt right now if I hadn't had surgery. I don't even remember what it was like before surgery. It feels normal, it feels natural, and I don't regret a single part of it. However, recovery is fucking difficult. So I want to talk about why that was. Post-op depression is really common, and I was fully expecting it to happen going in, but it was just the severity to which I felt it, the things that I was feeling it about that weren't even all surgery related, and also the amount of time that it lasted for, and the way that it could even come and go in waves. Like, I was solidly, severely depressed for about a full month post-op. It kind of started feeling a little bit better, but then it just keeps going up and down. Like, sometimes I'll have, again, another period of 3 days where I'm like, everything is horrible and I don't want to be here, and then after another day I'll be like, well, what was all that about? I feel fine again. And obviously you can chalk it all up to, well, my body's just been through a hugely traumatic experience. It's a major surgery, of course it's going to have a huge emotional impact on anybody. It's a big life change. You also have to adjust to the fact that I have now got 2 massive fuck off scars on my body, and you know, as much as you're expecting it, you can't really visualize it or imagine what that's going to be like and how you're going to come to terms with it until it is actually on you, at which point it's stuck on you forever. And again, that's not me regressing it. This is much better than the alternative of having tits, but it's still hard to come to terms with having an aesthetic change to your body that maybe you don't necessarily want, but it's just kind of what you have to do
in order to achieve the result of the flat chest that you want. Because peri wasn't an option for me because I was just a little bit too big, which is fine. And that's not to say that having scars looks bad, it's just, again, not necessarily if I could have chosen what I would want. But you're really left with no choice in these situations. And I know there'd be people who argue, oh, you always have a choice. But you know, for people like me who have really, really strong dysphoria, it's kind of that or you die. So related to the depression is the sleep issues that I've been having. I've been suffering really badly with insomnia to the point where I'm sleeping every day around 7, 8 a.m. Some days I was waking up as late as 7 p.m. and I've brought it back a bit to like 3 p.m. But I'm trying to fix it, trying my best. I don't want this to scare anybody off. But at the same time, I watched as many videos as I possibly could get my hands on about top surgery and about how to deal with the recovery. I spoke to so many people that I know, and yes, I got the gist that it would be hard. Yes, I knew what to expect to the extent that I could possibly have known what to expect. But I wonder if a lot of the people who do make videos about top surgery are also worried about scaring other people off with how difficult it can get. I want to be as transparent about it as possible and be open to any questions about it, because maybe hearing about the extremes of it would have at least helped me to prepare for what was going to be a really difficult couple of months coming up. But again, it's kind of like a steady slope back uphill. Is that right? A slope uphill? Yeah, that's fine. Slopes can be uphill, they don't just have to be downhill. It's a climb. Miley Cyrus, it's a little bit of a climb to try and kind of get back to a semi-normal, regular headspace, sleeping pattern and self-image. I don't regret it at all. I'm very happy with my results. I still think the surgeon did an absolutely excellent job, especially in terms of chest contour. I think it looks amazing. Anything that happens with scarring or with wounds or whatever, it's just kind of one of those things that maybe it'll happen, maybe it won't if you get lucky. Unfortunately, I just had a little bit of difficulty and she doesn't quite want to close. But she will. It'll be fine. And at the end of the day, 10 years from now, that's all going to be totally faded. It really won't matter. When I was still in Hull, within a week after having top surgery, we stopped by a little charity shop just to, get me out and get some fresh air since I'd been lying down for so long. And I had a nice moment where I was looking at all of the clothes and going, oh, I can actually wear anything that I want here. And you don't even realize how much of the clothing section that you're not even considering wearing because, I'm worried about how my chest will look in that, or I'm worried about how that's going to look on me. I feel like I have unlocked like another half of a wardrobe that I can just wear if I want to. It's nice to have the option, even if I wouldn't wear it. I also had a nice moment at work before we shut down due to another lockdown, where I went to go and tuck my binder back in after going to the toilet, and I was like, oh wait, there isn't one. It's like the little moments where all of these things that you don't even realize that you did or that were impacting your life or slowing you down a little bit, it just unlocks little doors, and it just makes you like a little bit freer and freer every day when you're like, oh my god, I didn't realize how restricted that I felt. I can 100% say this was the right decision, and I can 100% say that life is better now than it was before surgery.
So this is what we're looking at 6 months post-op now. The scars have faded quite considerably. The nipples, even very recently, I had this little, I don't know what it's called. I had it kind of like a pimple blow up on here again and crust over and be all nasty, but now it's just gone kind of pink, and I'm still having a bit of discoloration on this nipple here, but honestly, it is not anything huge. It's not really a big deal to me anymore. It was putting me down quite a bit at the time, but now not so much. This one is fine. You can kind of see where the stitches were before, but again, it's not that noticeable, and I don't really care about that. But yeah, I'm very happy with how the scars are fading. What I'm doing right now is doing bio oil. I only do it once a morning. The bottle says to do it twice a day, but I found when I was trying to do it twice a day before, I would keep having that problem of like the scar getting irritated and something would rise up and open it up again. So I was like, okay, let me give it a break on the whole massaging the scars thing. So for now, I'm just doing once a day. And then when I find things are really, really settled down and there's no new developments in any of the chest area, I think I'll just start perpetually doing it once in the morning and once at night. Every now and then I use E45 cream as well, but because I'm doing the one-time massaging thing, I just pick the bio oil instead because people seem to say that gives better results, and they're fading nicely. So one annoying thing that does sometimes happen is like the skin on my nipples can get quite dry, especially right after a shower, so sometimes I will just put the bio oil on that as well, or the E45 cream. But again, I think these are things that mostly end up fixing themselves over time. I had also discussed before using like silicone scar strips and wearing those daily to try and make the scars even more faded. I think, again, when I tried doing it, I used Mepitac tape, which I'd heard from a few people was good, and it was causing me that same problem of, especially when I would take it off, I would have red splotches, and it looked like my skin wasn't very happy with it. So again, I'm gonna hold off on any taping or anything like that, maybe for another few months. Speaking of holding off on something, I had to hold off on working out for quite a while. I know a lot of people go back to exercise as early as 1 month in. I decided to leave it for pretty much 5 months, and now what I've been doing just to get myself back into the swing of things, I can lift my arms all the way up now and all of that. I just hit my hand on my wall. I've been just doing like 10 push-ups a day, then pushing up to 20 push-ups a day and that sort of thing, just because when I first started doing it, my chest felt very tight and it was like, oh, I feel like everything's just gonna rip apart, and obviously it's not, but you feel like that because you're so not used to it. But now things are starting to feel normal if I go and do push-ups or lift weights or whatever. I'm just also very conscious of stretching the scars any more than they already have, which again is really not bad, and they've faded quite a bit. But yes, I'm trying my best to keep things as optimal as they can be, I guess. I mean, I didn't even lift my arms above my head until literally like that 5 months. I tried to avoid lifting my arms completely above my head before then, because I'm really like, I want the best results I possibly can, especially considering the tiny little complications that I had. I never had anything bad enough where I had to go back into see a nurse or whatever, or get anything checked out. But yeah, just especially that little pockets that kept opening up, that was very annoying. So I'm glad that that seems to mostly have calmed down now. One interesting thing that I wasn't expecting, that I'm quite glad is a thing, that I haven't heard many other people say is a thing, is what I had been told was you'll have like perpetually hard nipples after top surgery, because like obviously you get them taken off and sewn back on, there's only so much they can do. But actually it's not the case for me. Like, they are soft, and then if they get cold or if I touch them, then they do get hard. I can't like feel them, there's no sensation whatsoever on them, which is fine. I didn't have very much before to begin with. But yeah, they do actually respond to cold and to touch and all of it. So yeah, fully functional nipples even after they have been removed from my body and stitched back on. I think that's pretty interesting. Science is pretty wild. I had some issues with hospital binders and all of that. They sent me one that wasn't the right size, they sent me home with one that wasn't the right size, and then they sent ones to my house that weren't the right size, and there was a lot of time where I didn't get to bind properly. But yeah, I guess I'm just bringing it all up again to say, like, in the end it turned out fine, and there are even people who don't bind at all after surgery. So obviously if your surgeon tells you to do it, then do it, because each surgeon has their own way of doing things, and the aftercare steps that they choose might specifically have something to do with what they did during surgery. So don't makeshift your own pathway for recovery. But yeah, it's not the end of the world if something happens to where you can't follow every step exactly in the way that you're supposed to. Other than that, it goes without saying, I probably would have said otherwise if it was the case, but don't regret it. Think it was a great decision. Honestly, I've most of the time now just forget that I've even had surgery. Like, I think in my brain this is what I had before surgery. Like, I can't imagine how I was living. I can't imagine what my life was like before having had surgery. It's just kind of like, my life starts now, and anything before then just, well, it's not that it didn't count, it's just like, I don't know, we're not thinking about that. In my mind, I had this the whole time. So I think that's a pretty good sign. There's nothing but peace on my end with all of this. Now I just need to go to the gym. Barely been working out at all, but want to properly build up the body and all of that. And see, I say that and I'm just going to jinx it, and I'm never going to do it, and you're just going to see me skinny and lanky this whole time. But maybe by saying it on video I'll manifest some motivation or something. I don't know. I'll wrap it up here, but thank you for listening to me drivel on about this surgery, and I hope you have a great day.